I appreciate the invitation to be here, and thanks for the attention and the focus on making sure that really what everybody needs or gets what they need in order to live the most full and productive and independent, self-determined life. I mean, that's really what all the work is about. You know, I thought I'd start with just a quick illustration about sometimes helping people to understand is the biggest hurdle. You know, I've noticed overall in trying to make the world work better for people with disabilities that I've found that people, they do care and they want to understand and they want to help, but oftentimes it's hard to get that audience or that focus or that attention to help somebody understand. Or, you know, for those of us parents that, you know, we don't want to disrupt the world, and are people going to accept us? And then sometimes we tend to hold back. In fact, I would say that the first 2 years, when we kind of knew our daughter had autism, and then when we got a diagnosis, and then for a while after that, we kind of hid away from the world. I mean, it just seemed like it was so hard to do everything, and how people looked at you, and it was just too much. So we stopped having friends. We stopped having friends over. We stopped going out to do things that everybody else just does. And then there was a turning point when I was actually out with my daughter one time, and there was a behavioral issue. And it was in a situation that was tough. You know, it was a situation where it was a bit unpredictable and noisy, and somebody, I imagine they probably thought that they were helping, but suggested that I needed to get control of my child, and so I went back and I said, you know, my daughter may or may not have just paid attention to what you said, but there's a lot more things happening in her life than what you could ever imagine. And it was like something clicked at that point. Like, I'm going to stop hiding. Right? I'm going to stop, like, not living a life because it might disrupt somebody else's life. And we're just going to go out there into the world, and the world is just going to have to deal with it. And that was the attitude, and that was right around that time when I decided that I wanted to get much more involved in public policy. So it started with autism, because that's just what I knew. And then it grew from there to being focused a lot on really healthcare from the neck up. So everything from substance use disorders, mental illnesses, developmental disabilities, that to try and get the world to work better. But what I've found is that any kind of difference that a person has, there are certain common themes and elements to it. If it's a small amount of the population, the same types of stigmas and issues that we deal with sometimes with religions or with race, the same types of issues can really affect those who are parts of other minority populations, including healthcare issues and disability issues. And so I really look at this as a civil rights struggle. When it comes to a person that has some kind of physical difference, and that difference is not related to the sorts of things that we normally think about in the discrimination world, like race or religion or gender or any of those things. But the struggles are the same, and in some ways they're much more accepted. Discrimination against people that have severe health care issues, developmental disabilities, physical disabilities, that discrimination in those areas is much more generally acceptable to our world than any other type of discrimination today. And it's one of the messages I wanted to ask that you think about. And I'll give you an example. If if a child with a disability, pick whatever, any kind of, let me not even use the word disability. Let's say any child that has a difference that makes their ability to function and interact in the world more difficult than a typical human being. Right? It has some kind of function that is either impaired or some sort of ability that they don't have. If a person has a dream for the world and they go out, and I'll give the Jim Abbott example. So there's a baseball player who's from Flint. Now, he was born without one of his hands. Now, Jim loves sports. He wanted to play sports, and there's nothing particularly extraordinary other than supportive parents and teachers and coaches that decided that they were going to figure out how to make sure that he was still able to do the things that he wanted to do. And that included not just playing sports, but he was the quarterback of the football team. But what he really loved was baseball. And not only did he really love baseball, he loved pitching. Now, I wonder how many kids would say, how many kids that happen to have that difference, right? One hand. How many kids would announce to all the people around them that I want to be a professional baseball player? And people say, for a person like you, it's not really very realistic. Right? For a person like you shouldn't be thinking about those sorts of things. Maybe we should let me help you explore the types of things that somebody like you ought to be doing. Now, in the disability world, that's a perfectly acceptable, unfortunately, a perfectly acceptable conversation. Those conversations happen all the time. Now, put a race in there, or a gender in there, or a religion in there, and you say, listen, for somebody of your gender, for somebody of your race, for somebody of your religion, you really shouldn't be thinking about this type of work. Right? We would never, ever accept that. And yet, if a person has a difference in their physical abilities, or a difference in their in the way that their brain is constructed, that somehow this becomes an acceptable reaction. Now with Jim, he had a teacher that decided that somebody had to tie his shoes for him every day, and there was no instruction manual on how to tie your shoes with one hand. Like, nobody knows how to do that. So this teacher every night spent about an hour every night for weeks trying to figure out and master how to tie your shoe with one hand. And he did figure it out. And then he taught Jim how to tie his shoe with one hand. The same person that encouraged him to go into not just play football, but to be the quarterback. But then they worked together, particularly between him and his dad, working together. And how can I develop the ability? How can I figure out how to be a pitcher with only one hand? And so what they decided to do was that he had this one hand, or this one arm, that he put his glove over. So imagine the glove like this, and it's over this arm, like that, just hanging down, just hanging on the arm. So here's his pitching hand, and he's got the ball, and he's going to throw the pitch. Right now, this is a fluid motion where the ball is being thrown in, and then he comes back in and sticks his hand in the glove, which is right here. Now he's ready to field. Let's say the ball comes right back at him. Not unusual for the pitcher to have to field a ball. Now what do you do? So he can field the ball. That's, he's got this hand that he's twice as good at as everybody else because he uses it for everything. And so he fields the ball, and then instead of having it upside down like this, now he puts it between his arm, pulls his hand out, and now he's holding the glove between his arm and his side. He reaches in the glove, and he throws the ball. Now, he had a lot of passion for it. He got very good at it. He went to play baseball at the University of Michigan. My uncle took me to see him in the late 80s playing there, and he said, there's a one-handed pitcher, and I really want to see it. Now, my Uncle George joked around all the time. I couldn't imagine that this was true. I thought it was a joke. So we went, and sure enough, here's Jim Abbott. He's pitching there, and he said he'll pitch in the big leagues one day. And he made it. I mean, he pitched for the Angels for 9 seasons. And not just made it, he's an all-star. Like an extraordinarily gifted picture. But the thing is that I wonder how many kids have a dream, and because there's some sort of a difference, we say to them, listen, that's not a very realistic dream for you to have. And let me kind of push you down this other track, or this other box that I perceive that you ought to be in. That box where people with differences are forced to live in or pushed to. That's what we need to fight against. I mean, there's this willingness to predetermine outcomes and not make allowance for how strong the human spirit is. And I wonder how many people that we miss out on. I can give you all kinds of examples of people that either overcame a tremendous amount of odds in order to live out the type of full life that they wanted to lead, or that somehow they were able to take what seemed to be a disadvantage in a different context, made it into an advantage. And there are contributions that so many people have that we're missing out on every day. And so making sure that the world works well for everybody, and we provide people the support that they need. In some cases, when it was a teacher who took an interest in Jim Abbott, right? I mean, that's a type of, that was the type of support that a child needed at one point to access the world. With other people, it's particular types of therapy or medicine, and in all of these cases, being able to support a person in pursuit of the life that they want to live it's what everything is about, what everything should be about. And I was happy to get the invitation to be here and wanted to share with you some thoughts and I can't pretend to be an expert on everything. I mean, I know that there's a tremendous amount of struggle, and I know that that there are a lot of limiting factors on being out there and taking advantage of so many things that the rest of us take for granted. And so to the extent that I could be a help to you in achieving the things that need to be achieved, I'd like you to think of me as a partner and see how we can change the world for a few more people. This business about changing the world, by the way, changing the world is really hard. But changing the world for individuals, it turns out, is not really that hard. So if we were to look at it on a person-by-person basis, and what can we do to help a person get to where they need or want to be, those goals are, all of a sudden you take these big daunting things, where do you start? Well, with the person, you can just start. And the key is, by the way, starting. I think about when we tried to get it was back in the 90s, trying to get dental coverage for kids. So many kids in Michigan didn't have dental coverage at all, and the Medicaid system wasn't working right, and dentists weren't taking it. And there was this partnership that 2 governors ago they went into with Delta Dental, and so they couldn't do the whole state, and they couldn't imagine ever doing the whole state, but they picked a couple counties and they just started. The key was they just started. Then the next year they added a few more, the next year, and okay, so that governor's gone, another governor's in place. And that governor says, well, look, there's a plan already in place for this. We need to add a few more counties, and we can kind of fit it in here. And then that governor leaves, and then there's another governor out. This year we were able to go statewide with dental coverage for kids. Now, back in the 90s, people were like, that's not, you just can't, there's no way we can ever do this. The key is to start. You just got to start somewhere, and be committed to taking steps forward every day or every year. And when you have that type of a mindset, sometimes it's slower than what you want to go. But that even that autism insurance reform, it was 8 years of failure before, and it was still a Herculean effort after 8 years of failure to get it to the point where we haven't even had a shot at getting a vote. So it takes it was a struggle that predated me, and a struggle that in other ways will continue after I'm gone. but if we're committed to making that incremental progress, when we can't take the big steps, take the small steps, and keep on trying to take the big steps. And then one of these days, all the ingredients are there, and then you get to where you want to be. So I'll stop there.
No, that's great and very inspiring, I think, and everybody can relate. I mean, it's very inspiring. So it was great, and I think if anybody has any questions, they can certainly ask you, but I know, and you can sit if you want, we're very much casual here, but you have another task force, the drug task force, correct?
Yeah.
So, and I was saying earlier, I'm really proud of everybody that showed up. Like I said, a few people had to leave, but we have a great turnout. We have a really good turnout. So what's your advice on where we should go from here and keeping the strength of the group and building on it?
Well, communication with people and relevancy is really important. So part of it is just so you have this bond, like you have something that brings you together. And if it's like with autism, I know that whenever I meet another parent of a child with autism, whether it's adult children with autism or they're just starting out in this journey, there's a connection right off the bat. It's like, okay, this is a person that understands. This is a person who knows me and knows the types of things that I struggle with and the types of things that I go for. So having that, finding your way to people, and then finding your way to people, and it's hard too because I mean I don't want to presume too much, but my guess is there's a whole bunch of people out there that the nature of just life with living with major struggles is such it doesn't lend itself very well to kind of being out and involved and active in things. You know, for us it was the amount of orchestration it took just to go get groceries was so extensive that that it was hard to imagine like getting involved as an activist in something. And so trying to figure out how to reach or engage with people and overcome whatever challenges or obstacles there are to that type of engagement is really important. And being and making sure that people know that you're out there. I mean, the nice thing about just on these devices here, that the ability to engage and connect with people in a very personal way is much more advanced than it's ever been. And finding people that need to be found and need to be connected. So exploring those types of strategies would be good as well. Now, when we started that, I'll give the autism insurance reform example. When we started that, remember 8 years of failure before it got passed, and all the major interest groups were against it, all of them. I mean, it was on both sides of the aisle, right? So the Democrats, Republicans, seems like they don't agree on anything. Well, they do agree on one thing, because you had business groups, insurance companies, and labor unions, right? Those three, they're never all together on something, but they were all against that bill on autism insurance reform. And even the autism insurance reform was still not very comprehensive in what it offers. It was the bare minimum, right? The autism insurance reform only covers the bare minimum of what would be required for a person with autism to have a shot at developing the social and communication skills they would need to access the world. And so you had this wall of the giants in the system that were all against it. When we were able to connect with I'll say the autism parents, but really it was the moms. There's an acronym that an instructor at Western Michigan University came up with. POAM, P-O-A-M, stands for Pissed Off Autism Moms. That passion was growing and people were getting connected, and all of a sudden we had 10,000 people. Now, I know because I was a state representative that if I get 50 communications, calls, emails, whatever, on one subject, it feels like the whole world's beaten down the door. Now imagine thousands. So we had these giants that were opposed to it, But then we had thousands of citizen activists that were finally connected and on the same message. And a lot of that was digital connection, but connected on the same message. And then when it came to a point when we were trying to take one of those steps, remember, there's even the approval of a law, that's a whole bunch of steps in the process to that. So every time we get to a critical step, we had this network of thousands of people that were engaged and essentially flooding. I mean, they had to be reckoned with. You could not ignore it. It was just too big. And so it just made its way through the process. Now, even with that, we still had a whole term where, we got through a whole bunch of the process, and at the very end, we had, if they put it up for a vote, we would have had it would have passed, because the people doing the voting wouldn't want to face the wrath of voting no. And so the only way they could stop it was to not give it a vote. And that's what they did. It didn't get a vote. So it died at the end of that legislative session. We'd start all over again. That was extremely disheartening. I remember going home that day. It was the last day of session 2010. I went home that day thinking, how can we overcome that? They won't even give us the vote. You can't win a vote if you don't even get the vote in the first place. And but after a week of sulking and being mad about it, then just pick ourselves up and get back to work. There's another term coming up, and we're just going to get back at this again. And about a little less than a year and a half later, it got all the way through and onto the governor's desk. Actually, I was the governor when it came. The Governor Snyder was in Afghanistan with Michigan National Guard troops, and so he was out, and the responsibilities fell to me. So I actually got to sign the bill, which was really cool. But there was but that was, as I look back, the perseverance is everything, but you have to have a lot of people persevering and connection, finding out how to reach people and get them on the same page, the same agenda, the same message, the same priorities, and then being able to kind of push the button at the right time. Timing is everything. So we're at a critical point right now, and whatever it is that we're trying to make happen, and we need a lot of people to engage to push. And if that happens, the system it can't ignore it. You don't necessarily mean you win, but you have to be dealt with. And being dealt with is the first point on the road to winning. So they say, there's this old saying, I forget who first said it, but first they ignore you, then they make fun of you, then they fight you, then you win. Right? I mean, so that's kind of the process that, in the beginning, maybe it's kind of like, I just got this little thing going on over here. I don't have to pay too much attention to it. And then when you start getting a little more, it's kind of like, yeah, but they're not a big deal. I mean, look at this. This is not much that we have to worry about. And then you start making progress, and now they start fighting you. Like, we've got to go against this. But that's when when people really start fighting you, that you're making progress. That was too long an answer to that question.
No, that was great. That was great. So
I have a question. What's the drug task force?
So on prescription drugs and opioids in particular, we put together a task force to try and to develop an agenda to create a system where Michigan is no longer, the feds tell us that we are the supplier of prescription opioids all across the eastern seaboard, that whatever our system and rules are here, that it's not just leading to the epidemic of overdoses and drug addiction here in our state, but that it's actually, we've become a supplier to so many other places. So what we did is we brought together people from a lot of different disciplines to talk about this. So everybody from the doctors and the osteopaths to the judges and police officers to the regulators within the system that we have today, to people that work in addiction treatment, and so though we had all that group of people together to come up with a comprehensive agenda, everything from prevention all the way through to treatment, and even things that intersect with incarceration and helping people that have been incarcerated to recover from addiction as well. So and to be released and have the support to be more successful later on. The one thing that was kind of a shocker to me was that I assumed that in this day and age, that if I'm an emergency room doctor, that a person comes in presenting with whatever type of pain, and they're looking for a particular type of prescription, that I'd be able to look on the system, some system, and see whether or not this person had a prescription in the next ER over, in the next town over. And it turns out you can't see that. So in a lot of ways, we were asking doctors to practice blind. And sometimes say, well, can't you tell if somebody's faking it? When a person is addicted, and they, particularly to something as powerful as opioids, and they're in withdrawal from that, they are experiencing real pain. I mean, it's not that somebody's making up, like presenting with fake pain. And but the other thing the other problem that we have is that we've tried to deal with addiction in the law enforcement world, like being addicted as a crime, and that's the broader philosophical shift we're trying to make with this, is that a person who is dealing with addiction, addiction is not a criminal justice issue, and it's a healthcare issue. It's a physical healthcare issue in a person's way that their brain works. And the more we learned about the science, the more the task force and I would definitely put myself in this category, understood that we were not, our intervention strategies or our way of trying to deal with addiction was completely backward from what it needed to be. That assuming that a person, throwing somebody in jail is going to cure them of their addiction. I mean, that's just, or that you could take a person off a drug for a while and they would stop wanting it. And that's just that's not the case. And in fact, I'd say the most heartbreaking thing that I came across on this is that so many of the deaths that are experienced in overdoses are exactly the people that were trying to quit. Because when they would quit and be successful for a period of time, and then when they'd have a relapse, and recovery is not a straight line, there's going to be relapses, that they would go back to the original dose that they used to be able to handle, and now they can't. And so because of that period of time, now they get into overdose. So anyway, we had a lot of, there were a couple of dozen recommendations. The first one is to have a centralized system where doctors could consult with, that would give a complete prescription history of whoever they're dealing with. So they could either identify addiction risks and take whatever action they feel is appropriate. One thing that, though, we are not going to do, that task force didn't recommend, and we're not going to get into, is to try and regulate when a doctor should and should not write a prescription. Right? We don't have that. There's not a cut and dried black line rule that we could apply and put into the law. All we're trying to do is to make sure that doctors have the information, the full and complete information when they're making their decisions. And then the other thing that we were going to ask for, and both the MDs and the osteopaths were supportive of this, was on the continuing education to really start to add in additional information on addiction treatment and how addiction starts. And we've gotten really good at treating pain, and that's it's probably a reaction starting with back when assisted suicide was something that was really in the news a lot, and people were experiencing terrible pain enough to where they wanted to die. I mean, it's the only way out, and not wanted to die, but wanted to make the pain stop. And so I think there's a wake-up call that, like, we've got to do better on treating pain. And so now I feel like we're at the second wake-up call of, we've got to do better dealing with pain, but we also have to make sure that we manage addiction properly. And one of the things as simple as knowing when a person gets a prescription, what are the risks? Like, you could take this exactly as prescribed and maybe still become addicted. And how many people know that? With antibiotics, we're always told, right, take it all the way to the end. Even if you're feeling better, keep on taking it. Well, that's really bad advice for OxyContin. So people might, we're kind of, we believe, or we know what we've been told on one type of medicine, and maybe we should know the difference on the other type of medicine, but we don't always understand the risks. We just assume, well, we got this, went to the hospital or went to my doctor, I got this prescription, it must be safe. Well, it might be necessary, but there are risks, and how do we manage the risks? And making so the continuing education part was one that we're pretty excited about, and how to help patients understand and manage their own risks better too, as a partner in the healthcare process.
And then thank you. And then how do you think we can keep you informed? What's the best way as far as this task force goes to keep you up to date?
Well, I happen to have, with me here today. Normally, Kirsty's not on the road with me, but on Saturdays they divide up the responsibilities. So she's the policy focused person in my office. So I have some that do bill drafting, and I have some to do, and when it comes to development of policy and interaction with the legislative process, that Kirsty is my lead person. So if you get her contact information, then that's a direct line to me at any time. Okay. And then as you move forward, you prioritize, like, here's the next thing that's needed. Sometimes there are things that we can do in the rulemaking process, that we can just kind of, the way that we're operating or the way that our systems work, that we can just work out and do. Other times we've got to make changes in law. Sometimes it's a resource issue that we need an appropriation for. But to really, plug into and engage and prioritize, and if there's one word to hear out of today, prioritization. It's what's the most important thing, what's the first step, what's the thing and to really be able to settle on that and kind of have it, to the extent that it's possible, sometimes it's not, but to build consensus around what's the best first step here, the next step, I should say, that we need to take. And then I'd love to learn more about what that is and see how I can help.
Okay. And what in this state, for both of you, but what do you hear about CF? Is it out there, do you feel?
Well, I guess I hesitate to say no, it's not out there that much, but because it's a relative term. So if I were to compare CF to something like Fragile X, I would say yes, it's out there. If I were to compare it to something like autism, I'd say no. Awareness and kind of being a part of the public dialogue, it's not even close. So there is a lot of I think there's a lot of awareness, but I want you to think about awareness as a journey, not a destination. Right? Awareness doesn't actually get you anything other than a playing field that you could maybe win on. So when I started with talking with the groups on autism, it's like, we always talk about autism awareness, and then we get to a point when like everybody knows about it. It almost was like, for a while, it's just a discussion. It seemed like it was everywhere, and so awareness was going up. And okay, so you got all this awareness. What do you do with it? And the next thing was acceptance. So I look at it as the next step was, all right, so we're aware of what autism is. Now we have to be accepting of people with autism being a part of our world, right? That's the next step here, is that kind of unlocking the door and making sure that the world is open to people with autism. And then the next step is inclusion, right? You can have somebody in the room, but they're not really included. And inclusion is where that's the destination, is inclusion. Now, again, I'm talking about autism here. You might have other things or other, a different journey. But having that type of a roadmap out and understanding what your destination looks like. So if you were to ask me, Brian, when will you know what the destination? When do you know that you've arrived on the work with autism? I would say that It's when you have a world where a person being successful and independent with autism is not like this amazing thing where people are like, wow, I can't believe that happened. When that becomes just the norm, that a person, and I'd put the same, like with Down syndrome, for example. I know there was this story where a young man in New Mexico had a restaurant, and he was closing down the restaurant because he met this girl, and her hometown was in Colorado, and they were getting married, and he was going to open a restaurant in Colorado. And it was this really heartwarming story. Met the girl of his dreams. He had this successful business. He's going to leave that behind, open up a new business where they were going to move to. And I shared it on Facebook, and and everybody was like, "Oh, that's great," and everything. But the fact that a person with Down syndrome getting married and having his own business, the fact that was national news, it was like one of the feel-good stories, on one of the like the Good Morning America or one of those type of shows, and the fact that it was national news, it shows me how far we have to go. Like, it's that unusual of an outcome, and so that's the destination I have in mind, is that a person can have a neurological difference, and them living a full and successful and complete life is no longer an unusual outcome. We're like, that's amazing. When I would no longer even think that, another guy having a restaurant, I would never share that on Facebook, right? I would never look, here's a guy from Royal Oak that started a restaurant and he's doing really well. I mean, I wouldn't do that. And so it's that's what I would recommend, is to have an idea of what your destination is, and then an idea of what the steps are to get there. I'm getting the signal. I have